I've been working in the drugs field for 20 years, and from when I started, harm reduction was an established good thing. It was contested. Some people, weren't too keen on aspects of it, but harm reduction was accepted as something that had a very important role to play when you were dealing with drugs issues. And I kind of brought that forward, and now spent 2 years working in central government, and I joined the London Drug Policy Forum in 2001. Now, one of the things that we were always saying in the drugs field, why don't we do more with alcohol? We should join it up with alcohol. In only 9 years, it took me to add alcohol to what had been the London Drug Policy Forum's remit, and we added alcohol in. But looking back, in many ways, we were rather blind to the fact that the vast majority of people who had drug problems and the vast majority of people who had alcohol problems also smoked. And we didn't really look at that. A statistic I got from Public Health England 2 weeks ago was that 80% of dependent drinkers smoke. And yet, it wasn't really on our radar at all. And that was one side, if you like. That was my professional journey getting towards thinking we're not really looking at the thing that actually kills most people and affects the vast majority of people who've got substance misuse problems. But I started work, I was a trustee for a significant alcohol and drug service in East London. And to be honest, they had a similar journey. They'd started off as an alcohol service, followed the money into drugs in the late 90s, and then started doing some smoking cessation work. And I was a bit sceptical. I kind of had this idea that actually people smoking cessation and all that, you need to sort out all their other problems, and then maybe somewhere down the track, then you look at the smoking bit. And I was very used to turning up to the service that was on Romford Road in Stratford, and you'd see the clients all sitting on the road outside, having a cigarette, you have a chat. But when they started doing the smoking cessation, it was something they were really interested in. This was something they wanted to do. And as sceptical as I was about the value of giving people piggy banks, they really liked having the piggy banks to put their money in. People were incredibly proud about what they were doing themselves, largely. From the charity's point of view, I have to say it was almost money for old rope, because you phoned people up and said, are you still not smoking? Everyone went, yes. So you always achieved your outcomes, and the funder went, well done, have some more money. But obviously a lot of them did relapse. But actually it was something they were proud of, that they could do, that was very quantifiable. So that converted me at a personal level, talking to some of the clients there. And at the same time, some of the people in this room tonight were getting interested, and I was also keen to try to get drugs and alcohol out of its silo, which led to the City Health conferences and working with KAC. And when you broaden it out, and in my main role now as Head of Community Safety in the City of London, we are still only stumbling towards recognising how big an issue that smoking is for a lot of our target populations of concern, and actually that there is stuff we can do and that people actually can engage with. So I mean the mental health figures, 40% of those with a significant mental health illness smoke. Big issue in the city, rough sleepers. The groundswell figures give you a figure of 85%. I can tell you if I talk to the rough sleeping team in the city, they have never found the 15% who don't. So I mean, this is a huge problem. And yet, we are still really slow and still very tentatively going, should we do this, should we not? And I go back to where I started, harm reduction really, in the drugs field, there's no dispute, argument, it's an important part. And it does rather stun me and dismay me to an extent that when we bring it across to tobacco, which kills far more people, often kills the people we're concerned about earlier than their other conditions, we're still going, should we, can we, does it really exist? And of course in here we do, but my final point, if, I know it's been disputed much recently, but I also enjoyed seeing a very vigorous defence recently. If we go for, vaping is 95% safer than smoking. Can you imagine the clamour that would be in the drugs field if we came out with a opiate substitute therapy that was 95% safer than using heroin, and that the clients paid for themselves and the social benefits, and people actually were proud of that they'd done. You know, we give people back agency. And one of the things I guess that really does, I hope there's opportunities there in looking at health inequalities in groups that often don't have a lot of agency, and people go, oh, it's terrible. You know, these people are so marginalised, they don't get the opportunity to take control of their lives. Well, this is an area where there's a lot of scope to improve upon that. And I do hope that we can fairly rapidly see that tobacco harm reduction is as established and is accepted, because it should be, as drugs harm reduction. And I will now hand over to Professor Stimson. Final comment. Very worried that a lot of you didn't get the email about the dress code. This time we'll let it go.
Thank you, Dave, and thank you very much for inviting us into your lovely home. We know you always dress for dinner, and we forgot about that. I spent most of my life doing social science research, and then social science research linked to public health. I spent up 40 years doing that until I realised I'd probably made a bad career decision and wanted to do something else. But joking aside, I was very privileged to be around in the late 80s, early 90s, when we first started to tackle the potential for HIV to spread amongst people who injected drugs. And so I was an academic, outside observer, doing the evaluation of various interventions like needle exchange and methadone and so on. But I soon became, as it were, a card-carrying harm reductionist, because I could see that enabling people to make healthier decisions, making it possible for people to change, was very important. And of course, the UK response to HIV has been a huge public health success. You know, we prevented a major epidemic of HIV. I was a latecomer to work on smoking and tobacco, but when I first heard about e-cigarettes, I thought, well, it's kind of obvious, isn't it? Here you've got a safer product, a non-combustible product. People like using e-cigarettes, and so everybody in public health and elsewhere will put their energy behind this, and we've solved the smoking problem. As you know, not quite turned out like that. But here, you know, you've got a safer product enabling a safer behaviour, fundamental principle of harm reduction. Difficulty for many people in public health and in medicine is that they didn't invent it. It came from somewhere else, and they weren't the enablers, because the people who were doing it were enabling themselves. You know, what public health is all the time trying to do is to persuade us to drink a little less, eat a better diet and all the rest of it. Sometimes these public health movements, small p, small h, come from left field. Suddenly you've got a whole social movement around this new arena, which isn't owned by capital P public health, owned by medicine. So the arrival of the technologies, the arrival of e-cigarettes, longer standing products, harm-reduced products such as Swedish snus, newer heated tobacco products, these kind of literally put healthy behaviour into people's own hands. It offers new choices to millions of people around the world who want to switch from smoking. And the numbers who could be affected by this are immense. You know, a billion smokers, 7 million smoking-related deaths every year, which is more than the combined deaths from AIDS, malaria, and tuberculosis. So kind of, I sometimes think if we were treating this like we dealt with AIDS, we'd be much further along. But unfortunately, we get trapped in certain ways of responding to smoking. I think the other thing that struck me when I first came into this field was how many people in tobacco control were deliberately using stigma to help people. Now, working in AIDS and other areas, the thrust of our work was to destigmatise, but here you had quite sensible people saying, well, you know, stigma is good because it makes people feel ashamed, it makes people feel uncomfortable with what they're doing, and that will help them. That's quite bizarre. So a lot of sticks to get people to stop smoking, but not enough carrots, not enough easy exits. And that's why safer nicotine products provide the easy exits, and they actually provide an enjoyable exit. If you are a smoker and you go to your GP and the GP says, well, try NRT, firstly, it's a pretty boring thing to use. You're already feeling miserable because you're a smoker. You're given a medical treatment which sort of feel a bit miserable because it's not giving you the enjoyment that you had before. So the whole perception of this is, it's adding to the misery, whereas e-cigarettes and other safer nicotine products offer people, I think, an easy route to slip from doing one thing to doing another, and something that you can enjoy. So, all the stuff going on in the US about flavours at the moment, flavours are important because they give people choices, different devices. Many vapers are hobbyists, they have daft collections of, a whole row of spending all their money on this stuff. I mean, it's like Jeremy Clarkson on vaping mods, and some people who are really into it spend perhaps a little bit too much time on forums and all the rest of it. But it's an easy way to slip into this. There have never been NRT forums and websites. Nobody's saying, have you heard about this new NRT or this, there's never been NRT fests, but there are vape fests. So it actually enables people to continue to use nicotine for whatever reason they want to use nicotine without facing the problems connected with combustion. The evidence is that this is working in countries which have allowed it to happen. So the UK stands out as a beacon globally in vaping regulation and policy. Doesn't with respect to snus, because the UK persuaded the EU to ban snus. I'm no fan of Brexit, but there may be an opportunity there to remedy that. So UK stands out, smoking dropping dramatically, vaping rising. So you've got this crossover, 6 to 7% of the adult population vaping, 14% or so of the adult population smoking, down from around 22% 5 or 6, 7 years ago. So the smoking trajectory is going down. Sweden, due to snus, the lowest rate of smoking in Europe, 5% of the adult population smoke in Sweden. Sweden has the lowest level of tobacco-related disease in Europe. Norway, again with snus, rapidly smoking is disappearing. Amongst young women, 1% smoke. 10 years ago, 17 or 18. But about 14 or 15% of young women use snus. So there's been that crossover. So smoking has virtually disappeared amongst young women in Norway. And in Japan, with heated tobacco products, the cigarette market is just collapsing. So over the last 3 to 4 years since the introduction of heated tobacco products, the cigarette market in Japan has dropped by 33%. That's absolutely staggering, with switching to other products. So this is a kind of a consumer-driven public health movement. So it's for regulators, it's for professionals to support this. They're not really involved in doing it. And as I often say, no taxpayers have been hurt in this process. It's not like some of the big public health interventions we have to do where we have to raise millions of pounds to launch a public health event. No public money has gone into this at all. And that's quite unusual for areas of public health behaviour where people are making big changes. UK's led the way, much to be commended. It's kind of the keep calm and carry on. Okay, in the US, there's the youth vaping crisis, there's the lung crisis, conflation of the cannabis vaping with nicotine vaping. In the US, it's like the war on drugs has now become the war on vaping. The concern, in the US, there's a lot of concern about the kids. But US kids are doing all sorts of things and killing themselves with all sorts of things. Driving and drinking are the biggest killers of kids in the US. Marijuana use, alcohol use, far more significant than vaping. So, to cut a long story short, this is one of our. We're launching this today. It's meant to be a short introduction to tobacco harm reduction, but it got a bit longer than being short, but we'll hear about that in a minute from Ruth. So we do a number of things around we have this project called the Global State of Tobacco Harm Reduction. There's a big report. We have a website, global information. You can do country searches on whatever. But this is meant to be an easy way to find out the ideas about tobacco harm reduction. So that's why I'm very pleased to be here today to launch the English version. And I'm on the cover. So you'll remember the report. And so thank you very much for coming tonight, and I hope you take away a copy, and you can get copies from us if you want to pass them on to other people. So I'd now like to, having taken all the credit for this, I'd now like to hand you over to Ruth Goldsmith, who did all the hard work of writing the report. So, Ruth.
Hi. A lot of you won't know me. I'm relatively new to Knowledge Action Change and the Global State team. I'm the communications manager. And at parties, when people ask me what I do, I like testing out a range of responses. So, I work in communications about health. General recognition, most people stay with me, that's okay. Communications about public health, still fairly good. Communications about harm reduction, blank faces, a request to repeat the phrase. And so I do, because they're a captive audience at that point. So when I say that people will always do risky things, and they will always use substances, and that harm reduction is about helping people to do that in a safer way for them and for those around them, well, that's most often met with interest and understanding, and sometimes with compassion as well. People also seem interested when I say that rather than drug harm reduction, I now work in tobacco harm reduction. And I explain what safer nicotine products are. Everyone has an opinion on vaping here in the UK. And before their interest drops completely, I try to focus their attention on the real issue that underlies all of our work. And that's the fact that the estimations suggest that 1 billion people will have died of smoking-related diseases by the end of the century. And that we all know someone who's been affected through tobacco-related disease. So, with this briefing, it's kind of an extension of my party pitch, really. I'm hoping we can use it to introduce people to both harm reduction and tobacco harm reduction. With the right to health at the core of the argument, I want to help reframe the narrative that failure to ensure access to safer nicotine products for smokers must be seen as a risk to the lives of millions of people around the world and not as a threat to health. I also really want to use it to build bridges with our friends and allies working in interconnected fields, including those working with people who use drugs and alcohol, who are affected by homelessness, who have a diagnosed mental health problem, whose health is so drastically impacted by their tobacco use. We all need to go beyond our usual spheres of influence, our own little echo chamber, and build a groundswell of support. So that's where I need your help. If you can think of friends or colleagues or enemies who you would like to receive a copy of this briefing, then talk to me or contact me with your ideas. Because in a week when the World Health Organization has signalled its intention to double down, we need to advocate together from a position of strength and positivity and the evidence base about the important role that tobacco harm reduction can play in tackling the global public health crisis of tobacco smoking. Thank you very much. I'm now delighted to introduce our colleague Roberto Sussman, who is not only a theoretical physicist, but also the leading advocate for tobacco harm reduction in Mexico. Thank you, Roberto.
Thank you. Thank you very much. I hope you forgive my jet lag. Well, I'm happy to address this community here. Harm reduction in other substances has a very direct relevance to the region where I live. So the drug wars, for Latin America, the drug wars is death. Is being a war zone like in Syria. That doesn't mean you cannot come to Mexico. I mean, that doesn't mean that the moment you land and you put your feet on Mexican soil, you will be ambushed by sicarians and so on. No. Violence happens in certain designated areas, but the effects, they filter to all society. In the area where I live, in Mexico, nearby Mexico City, we suffered personally the effects of the drug war. Is not only bringing drugs to the U.S. It's because crime. It's a multifactorial activity. And anyway, I'll spare you the details. It's a long story, but harm reduction is important because it's one of the tools that we have for trying to solve this conundrum of violence and misery in our region. It's very important. Now, it's very important that we think of harm reduction in an universal term, because there are variations. Like you can say, well, the marijuana people, and I'm very much in contact with activists who are fighting for the legalization of marijuana, which the government is apparently supporting. And sometimes they say, well, but why do you complain? You're legal. We're not legal. But that's just one side effect of the issue. Like there is a lot. There are much more things in common between the attitudes of stigmatization of users in illegal and also in legal substances. There are much more things in common. And one of the interesting things is when I was talking to an activist who runs a clinic for people different types of people they have VHI, so they are stigmatized by being users of an illegal substance, but also because they are male homosexuals. And he was telling me how this clinic works in Mexico City. So it's supervised and has relatively decent standards. But if you go to provincial areas, especially in the north of Mexico, where the violence of the drug wars is more intense, what happens in these rehabilitation clinics is that the users of the substance, because whenever I said the word addict, he said, no, that word is forbidden. Never say addict. Users of substance. Never say drugs, they're substances. So users of substances, they are picked up. All the stuff, the substances that they carry are decommised. And you know what they are given as a consolation prize? Cigarettes. And that's a policy. And I say, why do they do that? Well, first of all, like about 60 or 70% are already smokers. But then there is a 30, 40% who are non-smokers. And because they are not going to be able to use the methamphetamine or the heroin or the cocaine, they'll have to do with cigarettes. I say, who the hell implemented this policy? Comes from the health ministry. Right? So there are many things to do. Not only there are many things that we can do together. Because then my proposal to this clinic and to a whole apparatus of people who work in these clinics is let us go, we Vapeo Mexico, which is an NGO that we're promoting harm reduction with tobacco. Let us go to these clinics and will tell these people about options, snooze, or even we can even energize vendors who will be happy to supply inexpensive electronic cigarettes so that these people who are in these rehabilitation clinics do not have to smoke if they're not smokers. We're not going to say, no, you must vape. No, it's optional. We believe in that people have to be given options, not to be hit with a stick. And we thought of a plan, and who do you think spoiled the plan? The health ministry. So these people were told, absolutely forbidden to work with these people because electronic cigarettes are illegal. And so, one of the main problems in Mexico, and as well as in all Latin America, electronic cigarettes, snus is unknown. And I think it's a bit difficult. The people don't like very much the idea of a chewing gum that will substitute to cigarettes. But vaping is very successful, but it is illegal. It's not illegal, the usage. There's not a situation like in Thailand or Saudi Arabia where usage is even illegal. Mexico is legal, use it. But the commercialization, it's illegal, and we are constantly under attack by the health ministry. Believe me, it's very hard to fight a whole government, a whole ministry that is against you in terms of resources. And so we're trying to, as an activist society, and association, and we are together with other associations in different countries, we're starting to get our act together. And what happens is what we see in our countries, in our region, is that there is a structural problem here. Perhaps it applies in other middle income, lower income countries, is that health ministries are chronically underfunded, very much underfunded, and they have to deal with other issues that are also the diabetes and even communicable, the sort of the communicable infectious diseases, right? So they're underfunded. Suddenly, you have this billionaire coming from the sky, whose name starts with B, and he's actually Michael Bloomberg. I would like to tell Michael Bloomberg that he should be the health minister of the region, because he's funding the health ministries, but with strings attached, and very, very big strings, not only in the issue of tobacco, but also sugar. So we're facing this machinery. This machinery is a lot of dollars, full-time people. And, however, on the other hand, there is another interesting situation about Latin America. And I said this when Ruth interviewed me in Mexico. What happens if the devil is telling the truth and the angels are lying? Who do you believe, right? So in countries like England or, Western Europe, even the US, Canada, or Australia, if the health authorities say, vaping, this kills children and will kill you in 2 months, and all sorts of, they say formaldehyde and popcorn cancer and things like that, and it's a guy with a white robe and some MD and all these type of things. People believe it for good reasons, because public health has been delivering a welfare system in Western Europe. So you tend to believe it. When they told you that you should wash your hands 100 years ago, people washed their hands and health improved. So there is a historical reason to believe public health. But now public health has become a sort of ministry, a sort of quasi-religious ministry in terms of non-communicable diseases, but people still believe it. Now, in Latin America, we don't believe the authorities, because public health has not delivered the same way it has delivered here. So perversely, we have some very good resources. Our struggle is not so hopeless because we are being attacked by public health. But if in Australia somebody says, no, that doctor is lying, actually vaping is not so bad, people are not going to believe it because they trust authorities. But in Mexico, Argentina, Brazil, Venezuela, Colombia, Ecuador, Peru, Paraguay, all these countries, if you say, no, they're lying, they believe you because. So that's an interesting point that in our societies. But anyway, to wrap up, I have many anecdotes, but probably people would like to have a glass of wine rather than all these anecdotes. The issue is Latin America is an important front in harm reduction, not only tobacco, but in harm reduction of other substances because of what I described. In terms of tobacco, it's also important because perhaps the northern part of Latin America is not very intensely smoking. Like Colombia, Ecuador, even Mexico, Central America, less than 14% of the population smoke. Much more people die from diabetes in Mexico than from smoking. But still, there are quite a few million people who die, and it's a health problem. And also there is an issue of illegal drugs, so we should really collaborate. We should really put bridges among ourselves. And I'm very happy that we will have the first road show in Latin America, and we're going to try to make noise there. We're already making noise, a lot of noise, partly because of the reasons that I'm telling you. See, people are listening to the message. It's nice developments are happening in the region, and so we're going to continue that. And I would like to thank very much Gerry and CAC for all the support that we are getting. And we see the United Kingdom in terms of vaping as really something very, very important, because it is only one government, and we use it in our speeches, because when they say, no, vaping is bad, kills people, and so on, so we say, do you think that the British government is going to poison its own citizens? And because our president said that he would like to turn the Mexican health system into something that looks like the British health system. So we say, well, the British health system is supporting this object, and so it's part of our warlike thing. So I'm also very happy that in England the health establishment was sufficiently lucid and sufficiently advanced to take this position. And okay, so thank you very much.
Thank you very much, Roberto, for making us all feel so good. Thank you to Ruth for speaking tonight. Thank you to Dave MacKintosh, who had to run off for an urgent appointment with the Metropolitan Police, but he may well be okay. And thank you all for coming tonight, and please, there's lots of drinks, there's food to go around, and there's lots of good chat to have with everybody who's here. And please take a copy of the report home with you, otherwise I'll have to take a lot home with me. So thank you very much.